Welcome to another fine episode of In the Raw at Pro Raw with me, Andrew Locke, and today, special guest, Dr. Dani. Dr. Dani, good to catch you in town.
Thanks for having me, Andrew.
Well, first time I saw you here at Pro Raw, you were squatting here and doing some work with the great EMAD.
That's right.
It's been fantastic, and since then, not only have you been training well, but you've competed now in a WBFF?
Yeah, that's right. So I came here probably about 3 months ago for the first time and basically got everything reevaluated, my squat technique, deadlift, everything. And it was a very eye-opening experience, but it's been very transformational nonetheless. And then I ran into you, and so much has changed in that time.
It was interesting because it looked like you were heading towards this power-based building, and then suddenly something changed and you said, I've got to do this contest. What happened?
Yeah, well, I've been competing for about 4 years now. So
in which federation and what were you doing?
So I started off in the ICN. I did 2 competitions in 2016.
And which categories were you doing then?
Bikini.
Yep.
And then sports. So then I took some time off, went back into the WBFF.
Yeah.
So they're the interstate competitions, and fell in love with that federation.
Right.
Then I had more time off. Which you've got to do as an athlete. You can't sort of always be on all the time.
Yep.
Really important to have that.
What do you find time off for you involves? What don't you do and what do you do?
So everything's still monitored in terms of training and nutrition. However, I'm not in a calorie deficit. I'm looking to build and get stronger and focus on other areas of life as well. So have a little bit more leeway, and then when it's go time, it's go time. So I thought I was going to dive into sort of the powerlifting style.
Yeah, it looked like you were heading that way.
I just had an itch that I had to scratch again. It had been 18 months since I've been on stage, and then just decided to do it.
How many weeks out was that?
Probably about 13. Normally I'd recommend more, but it was my 5th show. I'd known what works for me, and I really wanted it that bad, so I was willing to do whatever it took to get back on stage.
There it was, so 13-week prep, and how'd you go?
I came first and got my pro card, so
awesome.
Pretty happy with that.
Now with WBFF, what will a pro card enable you to do? What things are you going to be pursuing with that as a dream?
Yeah,
what contest do you go to?
I can still compete. There's always another level, so now I can compete against all the pro athletes.
Yep.
But it's also really just a platform just to network and get myself out there and meet some cool people. So that's the part that I enjoy about it as well.
So you scratched the itch.
Yeah.
Is it itchy again? Is there something else that's coming up? What amazing things?
In terms of competing, I'll take another year off. I'll do another show next year. I want to spend more time with you guys, learning how to lift heavy and properly, but also fine-tuning my base. I remember when I was squatting, the bar was on a little bit crooked. Within the first time meeting you, within the first minute, gave me the bird dog cat camel, got the bar back on, and it was straight. And then that's what sort of really opened my eyes up to what you do.
Yeah, now you're a doctor of osteopathy.
Yeah.
I mean, this is an area of things that's obviously combines with your passion. Bodies, people. It's got to be a fantastic opportunity. You've fallen in to be able to have a profession that actually really works with what you're passionate about. How do you feel about that?
Pretty happy. Like, not many people can say they love what they do. And for me, really, it's just been trial and error. Like, I've got visions along the way, but I'm just following what I enjoy doing and aligning with people like yourself who just really open my eyes to a whole new world of things. So in the osteo degree, we learnt a little bit of exercise, rehab stuff, but not that much. So that's why I'm really taking an extreme interest to what you do to be able to combine the two worlds. One of manual therapy, but then the other of functional rehabilitation. So I'm really passionate about bridging that gap that I've been finding.
It's great that obviously people who are going to be training for contests in the style of work that you do are going to know there's a professional who understands what they're doing.
Yeah.
That makes you a really good point person, obviously, as contact for these athletes. It's going to be fantastic for, say, the bikini athletes and the WBFF girls especially. They'll be looking at you and saying, if I've got a problem, at least I know someone who does what I do. I think it's really important for our professionals to have these people. So it's really great where you've got the rise of federations such as WBFF, which are doing such great work in the area.
Yeah.
And there's you also in the same point position who are growing along with it. Must be fantastic to be able to enjoy that. Very passionate.
It's good. Yes, and the exercises that you have created have really helped, particularly, bikini models. It is a stereotype, but it's about glute development.
Yeah.
And then the clam variation, you see people just trying so hard to grow their glutes, to get on stage, and they're just not doing it to the most efficient way. And then the little alterations that you've come up with, game changers, and then they can safely take that into all their lifts, not just for the aesthetics, but injury prevention.
And
it's
tell
so
me,
important.
From an osteopath's point of view, how do you view people when they come and see you? What's your perspective on people? How do you frame osteopathy for people? What do you think?
Yeah, it is a holistic approach to health and wellness. So I really like to see each person as an individual that come in. However, I find that people are lacking education on prevention. So they sort of wait until they're injured, then they come in. Manual therapy serves a purpose. However, it's really important to hit it early before people get injured. So an analogy that you've used that stuck with me was how you referred to the hip flexors, glutes and core to be workers. And the hip flexors are often the hardest workers, so they're tired naturally and get angry and aggravated. But yet we spend so much time trying to stretch it out, foam roll it out, needle it, and we're ignoring the two that are on holidays at the beach, core and glutes. We've got to strengthen them and get them working. And ever since I sort of heard that in your words, that's my interpretation, a light bulb just went off. And now I feel it's my right to educate all of my patients on that way of thinking.
It is. It's a development. I mean, I graduated such a long time ago that I began as a manual therapist, and that was where my master's degree went to. But stepping back, I moved into a more biomechanical view of people.
Yeah.
But the manual therapy was still necessary, as I refer people to the manual therapy world. I'm just busy doing what I do a little bit more.
Yeah.
But it's interesting. I almost don't look at myself as a physio. I look at myself being a movement health professional.
Yeah.
And I think that's what happens over time is we take things from all the professions, whether it's chiro, physio, osteo, myo, and we find there's lots of truths in all the professions. I think as we develop and more tools we get, we become less of a strict profession and more of just a great professional who understands human beings.
Yeah.
That's always the excitement for me in my profession, is knowing that every day I'll see something that changes something. And it's would I say there's many physios that do what I do? No. And as there are osteopaths, you're creating your own relationship to osteopathy and people.
Yeah.
So it's super exciting. And so we're looking at doing some video work together, I think, to educate people in the future, which is going to be great. And we'll be doing this through Pro Raw.
Definitely.
And when you came through, was there any particular areas of the body that were more interesting to you? Shoulders, hips, backs? What did you find was the thing that sparked you in rehab?
Definitely,
what do you like to see?
Definitely backs, because I feel like there's a lot of psychology that comes behind that as well. People often sort of hit the panic button when they feel a little bit of back pain, and just hearing the way that you've, in the seminar that I went to, which was fantastic, and your ways of teaching, just the psychology and language around things is really important as well. As you said, we're sort of all the disciplines emerging into one, including psychology, really. So what's your theory on pain psychology and all of that?
One of the things I think is really important is that communication has always been universal in all our professions. It's nothing new. So what's the purpose of us when we talk to a patient who comes in is we're actually trying to understand the patient in the first place. We're trying to understand how do they communicate their experience and what's it like to look from their eyes. Now that's nothing new. Yet we're seeing a lot of people who are thinking this is new and it's being taught as this new science. And I go, gee, 50 years ago, if not longer, there was a great Australian professional called Jeff Maitland. And his whole first chapter as a great manual therapist is all about communication. Communication's always been there. And we're always listening to people. So I don't think there's anything new in this so-called pain science. I think it's been around forever and we've always been doing it. So to me it's almost never separate. A communication issue is never separate from a human being. So even if you put your hands on a person, that's a communication to the person. They've got to feel comfortable with you. They've got to, and when you say what you're going to do, if it's a manipulative procedure, you explain it, you're communicating. their body's in your hands, they're accepting you as a professional. That's communication. So I think physical and even verbal communication, we have it all.
Yeah.
So I really don't see it as separate.
Yep.
Every interaction we have is that way. And I think that's where the professionals just should accept that we always communicate it. So we need to get on with becoming better at understanding, well, the real truths of problems. Back pain, I don't think is very complex. Yeah, you'll find a lot of professionals who think it is complex. I always think the more you know about something, the simpler it is to understand. And that's the beauty of it. The more experience we get, the more we're going to have fun with this.
Yeah.
So it's like you found about glutes. Well, isn't that just a world on itself?
Yeah.
Glutes are a magnificent investigation and study.
Definitely.
And
not only for sorry to interrupt, not only for the bikini models that we spoke about at the start, but for everyone, general population. We all need that.
We sure do. I mean, my favourite is you tend to see the 40-year-old guys and above who basically don't have butts because most people are sitting down their professions forever and their glutes haven't been given a reason to turn on. And then they come to the gym and they try and deadlift. Well, no wonder their back gets sore because their back's all that's left.
Yeah.
Yeah, I think this is beautiful for us as health professionals. And what was the biggest lessons that you got out of osteopathy when you look back and you say, when you got your degree, what did you learn that sticks with you and said, this is why I'm an osteopath?
There's just so many, and every day I'm just so grateful to do what I do, but just to be able to, I just find that so many people don't know what to do, and I just love, as I'm learning, being able to help educate others and give them reassurance that there is help that is not in the form of medication and all of the Western medicine side. There's a time and a place, of course, but just with some movement patterning or with some hands-on treatment and the right mindset, people can be pain-free, and that enhances all aspects of their life.
So better living through movement.
Yes.
And better living through strength.
Yes.
So that's our world, isn't it? We're not looking after people who are coming to see us just for stretching or just for manipulation. You're actually looking to say this is a lifestyle.
Yes.
So you're almost a lifestyle osteopath.
There you go.
That's what you define yourself as, and that's why people will come to see you as a professional. So within your own training, have you got a favourite lifter you work with? What do you enjoy most?
A favourite lifter that I work with?
A favourite thing you enjoy working with, a favourite exercise.
Yes.
What's your favourite? What makes you come to the gym and smile when you know you got it?
Oh, there's so many, but now that I've learned how to do it properly, I'm squatting and deadlifting, to be honest.
Yep.
Being a trainer for 7-8 years, my technique was good. However, in that off season that I had, the sort of 10 to 12 weeks with you guys, just being able to really push those numbers, I'm just feeling amazing on a functional standpoint, but also aesthetic as well. So
it's good, yeah.
The squats and deadlifts, because you really have to tap into that sort of frame of mind just to give it everything, and I love that.
So you saw a really good change in your most recent comp to the one before?
Definitely.
Yeah.
And that's why I suppose I went from second place to first.
Great.
Yeah. So
what was the biggest changes in you physically?
Definitely just more muscular development, but I spent a lot of time doing the activation protocols beforehand. The big three, the shoulder big three, hip big three, all of the big threes that you've come up with.
It's amazing, isn't it? Yeah. Yeah, I think Professor McGill gave us so much to work with his concepts, and it's up to us always to continue on the legacy of these great people.
Yes.
And you've had some interaction with the wonderful Hattie Boydell as well.
Yes.
She's been a good mentor in her way as well, some good advice.
Yeah, I've been with her for 4 years now.
Oh, great.
Yeah, so when I say sort of off-season or development season, I've still been under her guidance. And I remember her talking about you years ago when she came and visited you and got some advice. And it's really cool that we can all interact together. And that's why I love having so many different mentors like you, Emad, Hattie. Now I'm starting to really take interest into Stuart McGill. I know I'm a bit late on the ball with that, but so once I find people who are elite at what they do, I really I'm like a puppy dog. I just want to learn everything. So.
And Hattie is such a truly inspirational individual.
Yes.
It's just wonderful. Her work ethic is exceptional.
Definitely.
Her technique is always, without negotiation, she works beautifully.
Yes.
It takes a lot of years to get to that level of excellence, doesn't it?
It does. A lot of years, passion, hard work, and consistency as well. I think people, especially in this day and age, we want everything straight away, and I've been in that frame as well. You know, we want to be the best right away, but that takes away the fulfillment. It takes away everything we have to go through to learn and go
Yes.
through to get that result.
So much of the journey we really have it's to be enjoyed.
Yes,
It's not about the end point. Gosh, have anyone really ever reaches the end point?
that's right.
You know,
and when you do, there's always another one.
absolutely.
There's always more.
We're never rarely ever satisfied. A workout can be fantastic, but we're still coming for the next one because we want to be better.
Yes,
So yeah, we can reach our goals, but it means we've got another one tomorrow.
that's right.
And that's probably the most passionate thing I love about our weight training world is there's nothing static or running out the white flag and giving up. It's always about, if I got something, I can get better. If I've done this much today, I can do more another time. And how we have to program ourselves for that.
Yes.
And even professionally, I think we do that as well. You know, we find sometimes the clients who come in who challenge us, and that means we've got to get better.
Yes, definitely.
That's probably things I think that's consistent within health professionals who work with weight trainers. I think they're the most progressive people that you find.
Yeah.
And yes, you know, if you ever get the chance, there's the Swiss conference next year. That's the Society for Weight Training Injury Specialists in Canada in 2020.
Amazing.
Yeah, that's I'll be heading over to that. I think maybe Sebastian will come as well.
Yeah.
But these are the great sort of things where education comes in. There's some great individuals worldwide that we tap into. So have you got any other inspirations within the professional field that you look to? Any things that worked that make you inspired?
Yeah, just as you sort of said, you reach a goal and then there's always a new one and a new one and a new one. So as I sort of align with people like yourself, and the people that you look up to or you learn from, then that inspires me. So who would you say the top people are that you have learned from over the years?
One of the great ones was back in the late 90s, early 2000s, was a guy called Pavel Tsatsouline. He's a Russian. Wrote a couple of beautiful books, really, that were based around straightforward physiology. So I always recommend his initial book, Power to the People. I think it should be on everybody's bookshelf.
Okay.
I always thought that about McGill's low back disorders. It's a great piece of work. I love Mackenzie's work, Robert Mackenzie, but it's not as accessible, I think, as McGill's books.
Okay.
Mackenzie has a book called Treat Your Own Back, which is great for the acute patient. But as a professional, you need to read more research papers. One of the things I always find within my profession and our professions especially, is people talk about evidence-based research, but if evidence conflicts with science, the evidence-based research is probably wrong. And so people have tended to get lost looking for and saying evidence doesn't support this. Yeah, but science supports it.
Yeah.
And if science supports it, that's when the evidence has to be better tested. So I always say, be very careful of evidence-based research, because the criteria academically can be very poor. Because people don't know what they don't know. But science is straightforward. Physics and anatomy, we know what we have there.
Yep.
So I always say, when it comes back to it, go back to your basic sciences. That's always my thing. I will always go back to the basic anatomy books. I say, Brett Contreras with his glute work has always been an exceptional individual. And I always like the way he's actually called out people who his thought were a little bit questionable.
Yeah.
And have you ever read much of Brett's work as well, Contreras?
Yeah, and last year I was actually with Brett and Hattie's. I was at Brett and Hattie's seminar as well up in Sydney.
Delightful.
So yeah, it was really cool to be able to meet him in person and just see how he taught and spoke to people and the exercises that he swore by. But it's cool that he always, as you as well, continuing to read the science and the research and all of that, keep up to date. Because I feel that's where the industry is going. You know, we can't just be a personal trainer, or we can't just be one thing anymore. It's an ever-growing industry, which is amazing. So keeping all of us on our toes.
Yeah, you'll continue to be inspired, I think, by those. You'll find the place that you tend towards, and you might find that you become known as that person who is the person who works with the bikini bodies that are having challenges, and you'll be certainly very busy by doing that. You know, if they are there's so many athletes now getting up on stage.
Yeah.
And shoulder work necessarily as a bikini athlete. There's a lot of shoulder challenges. How do you enjoy doing shoulder work?
Yeah, well, coming from being a student for 8 years and my lack of education on shoulders, I used to actually get a lot of headaches. Just because I don't know, there were so many reasons, but now that I've taken on your exercises and being able to work on that, yeah, it's really helped for myself to the point where I want to study it more.
Oh, good.
Yeah, it's a complex joint, and well, in my eyes.
Yep, that's good. Well, I'll be able to help you on that one because I used to actually own the Melbourne Headache Clinic.
Well, there you go.
That was a thing I did for a long time.
Okay.
So headaches are an area which, yeah, I passed through that as well.
Yeah.
And now I don't do headaches at all. If I do,
How come?
well, they're very much a manual therapy approach.
Yeah, okay.
So headaches respond very well to appropriate manual therapy. So it's a little bit different to a lower back problem.
Yep.
Where we have a lot of compliance with strengthening work. What we have with a lot of the headaches that we're dealing with is there are some mechanical issues that do require some hands-on work. So if you're looking into headaches, well, there's some really good things to do there.
Yeah, there you go.
And it can affect people wonderfully. It can change. I've had people who've had 20 years of headaches who just thought that was natural.
Oh, wow.
And you can change their lives. Like anything, when you have great information. And the biggest things you've learned this year, obviously coming to Pro Raw, you've really passionately picked up the 3 main lifts.
Yes,
Yep.
that was definitely one of the areas, and just learning to ask more questions and align with more people like yourself, and really we can spend so long with our head in the textbook, and I did that for 8 years, but I've learned more just having conversations from people like yourself and getting hands-on and getting out there. So that was the biggest takeaway this year.
Well, I think that's one of the things you say there is you spent your time with your head in the textbooks, which then enables you to understand the conversations we have.
Yes.
So people who often come to me and ask whether they can do any shadowing or mentoring work, I tell them they have to attend all my courses before they attend it, because otherwise they're going to be asking questions they should already know. So the important thing is you spent your time studying. You already have obviously honoured the work by putting in the hard yards and going through what has to be done. Before you have to really become professional.
Yeah.
And then the questions that you're asking have a very solid framework behind them. So I think that's important for us to always communicate is, like you said about the journey, you've got to accept it's a long journey. You've got to pay your dues on the way. When you do, then it's so much easier because it's all bricks and mortar. You can't expect success overnight.
Yeah.
There's no instant cures that don't have a lot of good reasons behind them. Sometimes it's simple. So that's our job in this sort of place. You'll be coming down to Pro Raw to train quite regularly now?
Yeah, I'm trying to get down here as often as I can.
Good. Where else do you train?
So I've moved houses recently, so I'm still trying to find my feet, but I'm in the eastern suburbs at Spartan's Gym a little bit, and just down in South Yarra, but here is my sort of middle ground, my home, and I look forward to doing some more work out of Pro Raw as well, both treating people and taking people out on the gym floor. So
now that'll be awesome.
Yeah.
Now, where's your current practice? Where do you work from?
Yeah, so I work at Health Connection in South Yarra and Bliss Therapies in Heathmont.
Great. Whereabouts in South Yarra is that one?
On Claremont Street.
On Claremont Street. I know the area, yep.
Yeah,
and in Heathmont?
Heathmont, it's on Canterbury Road.
All right.
Very different demographic. So Heathmont's sort of your more athletes, sport population. South Yarra, more your office workers and all of that. But it's really cool to sort of course, that's a bit stereotypes, but they're the general patterns. It's cool to be able to sort of tap into both worlds.
People will know that they'll be able to contact you by finding those places, which is really great.
Yeah.
Or your Instagram, naturally.
Yes,
they can get you through that.
Yeah, on Dani Antonellos.
Dani Antonellos it is. All right, so we'll be doing some video work together. We'll be shooting at Pro Raw.
Yes.
People will be able to look forward to those things coming up very soon. So,
Very excited.
It's the end of the year. And Dr. Dani, fantastic. Congratulations on all your fantastic work this year.
Thank you so much.
I look forward to our work coming up.
Me too, Andrew. Thank you.
All right, train hard.